Today, Taoiseach, is a truly historic day. Joanna Sloan, 28, from Belfast, nurse working in her field, and Margaret Keenan, 90, originally from Fermanagh over in Coventry, receiving the first vaccine. Obviously, they're not the first people, they're the first people post-trial. So it is a historic day. And it's a historic day because science has delivered. Science works. We have now got vaccines. The scientists, colleagues, have done their work. They have delivered. Now, we all, as public representatives, need to support them. We need to support the scientists who have delivered these vaccines. And we must be very pro-vaccine. Historically, I and my party have been very pro-vaccine, as you know, Taoiseach. We pushed in the last Dáil for the HPV vaccine to be given to boys. I'm delighted that that has happened and has commenced. We fought in relation to other vaccines as well. I actually attended the Global Vaccination Conference last year in Brussels with the Deputy CMO, who was there as well. But I am concerned, Taoiseach. I am concerned about utterances by some public representatives in the past. I am concerned about the impact that it is having on our citizens. I'm concerned that many citizens are being fed lies about vaccines at a critical time, that many of our citizens are being fed deliberate misinformation. And I'm asking you quite publicly to deal with it. And we all have a role here. Today, the Labour Party has written to every single TD, Senator and MEP, every national public representative, and asked them, will they sign up to the vaccine? Will they promote the vaccine? Will they promote the public awareness campaign behind the vaccine and its full rollout? We're hoping that it will be 100%. And I would ask you, Taoiseach, to lead, and everyone else, if they'll sign it and return it within a week. Because we do need a public awareness campaign now, Taoiseach, ahead of the vaccine rollout, which hopefully will be early in the new year. And there is one other thing I would ask you to consider, Taoiseach, is much of the misinformation that is spread is done on social media platforms. In this city, we have Twitter, Facebook, TikTok, Google, and Instagram. We need to talk to them. We need to deal with misinformation that has been deliberately put out on those platforms. They all changed their algorithms and changed their rules in relation to the recent US election. They need to do so again in relation to the rollout of this vaccine and how it's so important for people's lives. And we in Ireland can lead on that through your role as Taoiseach, by talking to these social media companies who obviously are so powerful now in relation to how messaging gets out. Will you consider that? Thank you.
Well, thank the Deputy for raising the issue in relation to the vaccine. It is truly a historic day, and it is a vindication of science as the ultimate route through dealing with this terrible virus that has wreaked such havoc across the world in terms of lives lost, in terms of so many people who have become ill as a result of the virus and have longer-term consequences, the economic upheaval, the social upheaval. It has changed our very way of living. I applaud your initiative, and I would have no difficulty in signing such a petition. And indeed, we need to be very strong and positive in support of vaccination to eliminate a virus that has caused such devastation, ill health and death across the world. And the whole objective of vaccination historically has been to eliminate such diseases and such viruses. And the history of vaccination has been an extraordinary one in terms of the 20th century, for example, in terms of the transformation of healthcare and health outcomes, which is often forgotten as time moves on, and that which was horrendous in one era became commonplace in the next era and of no consequence because of vaccines and medicines more generally. We do need to make sure that fake news doesn't get prevalence or get sort of promoted on the various digital platforms that you referred to. I think that's a fair point. You know, I can recall all of the issues around the MMR vaccine when I was Minister for Health, and the huge damage that was done at the time. And we had to put up with the measles outbreaks for 2 or 3 years, and children being very ill and in some cases lost their life as a result of that campaign. We await the outcome of the European Medicines Authority in respect of the Pfizer-BioNTech vaccine, and then in the Moderna vaccine on the 11th of January. The government has announced today the provisional vaccine allocation strategy and the groups that will receive the vaccines in sequence, particularly the aged and those in our nursing homes and our healthcare workers as key priority groups. That is particularly important. I will receive the blueprint from the task force on Friday, and that will be the culmination of a lot of work undertaken by various work streams involving a lot of bodies. To be fair, in relation to the vaccine allocation strategy, the National Immunisation Committee, which has been responsible for many of the immunisation programmes, made a provisional recommendation. NEFIT have endorsed that recommendation in terms of the sequencing. And all I would say is individual deputies may have issues around that. You know, they might have their own sort of queries, but fundamentally we should allow the public health experts and science inform that as well. And I think if we allowed a situation where all deputies and senators were going to decide who gets what in sequence, I think we'd be here for quite a long time in itself. So I take the deputy's proposal on board as one that is designed to try and increase the participation rate in terms of the vaccines, make sure we get herd immunity and can eliminate this virus once and for all.
Deputy Kelly.
Thank you for your positive response, Taoiseach. And I would ask if every deputy, senator and MEP in the country would do the same. I would appreciate also if you would consider either yourself or a member of government would talk to all those social media companies. It would be very helpful, I think, both here and further afield. I have one query in relation to next Friday and the task force who have such a set amount of work to do. And it's relating to what database are we going to use to gather the information. I have a background in this area, Taoiseach, so I think about this a lot. The unique identification code we have in this country is our PPS number. So how are we going to gather all the information relating to people's health? Where is it going to be stored? Do we need legislation on this? Emergency legislation before Christmas? We had a lot of issues in this House relating to the public services card, as the Count Corley remembers. A lot of issues. Some of the issues I agreed with, some I didn't. But the information that's going to be stored in individuals here is going to be very deep, very personal, relating to their health. So do we need legislation relating to it? And finally, I presume the government has been in touch with the Data Protection Commissioner in advance in relation to this issue, and what have they advised?
Thank you. Taoiseach.
First of all, I think we should point out that about 2 million people, received the flu vaccine. So we're no strangers to national immunisation programmes, although this will be of a far greater scale than we've had so far. But there's been a very significant rollout of the flu vaccination programme in itself, and that worked very well, notwithstanding all of the complaints and criticisms. The task force is clearly one of the work streams is around an IT infrastructure, obviously to capture the data in terms of those who have been vaccinated, but also in terms of monitoring the vaccine effectiveness itself. How effective is the vaccine? Will it be monitoring the uptake of the vaccination and supporting post-vaccination evaluation? And the common good has to prevail here. This is a public health initiative designed to help the entire population in terms of the elimination of this virus, which has proved so devastating for so many. And legal advice is ongoing in relation to whether legislation is required or not on a number of fronts. But given it is our view that as things presently stand, we're in a position to move ahead.
Thank you, Taoiseach.
But just to suffice to say, the IT infrastructure is a key part of this, as are quite a number of other work streams as well.
Anish and Chocolate Habit Tobin, son and group